His name is Ralph. He's half Indian and a little shy, but curious. We're curious about him, too. Why he should have to limp his way through life. A simple foot deformity. Easy to correct. Minor operation. No problem. But a problem if allowed to go uncorrected. A physical handicap that can become a mental one. That can cause delinquency and maladjustment. That can make a child afraid. Good morning. No wars ever won have meant more to humanity than medicine's valiant triumphs over disease. Millions now living owe their lives to the soldiers of science in the laboratories. And the battle still goes on. The battle for new weapons against enemy microbes. The battle to get them to us in time. With BCG vaccine, it must be used quickly, within 7 days after leaving its laboratory 3,000 miles away. A vaccine that can help spare lives by building up a resistance against tuberculosis. We can spare no time. In the last war, it cost $245,000 to kill each enemy soldier. It cost 10 cents to inoculate a child against the enemy tuberculosis. Another kind of war. A war worth fighting. We try to look after health by looking after sickness. But sickness itself is not the only problem. Often we must deal with other problems before we can deal with sickness. Daughter does not earn enough to pay for the hospital care her mother needs. Yet she cannot be admitted on charity. Because she owns her house, she doesn't fit the rules. She can get no more on the mortgage. What can she do? Like thousands of others, in rural areas especially, she will come to rely on worthless home remedies. It may do her more harm than good. What else can she do? A hard question and a common one. We must find an answer. In Alaska, as in the States, there are far more people who go to work when they should not than those who lay off when they should not. Father couldn't leave his work because he couldn't afford to be sick. Couldn't afford common sense. Neglecting an illness only increases its cost in the end. Often a patient's recovery depends mainly upon good nursing care, and the time and ability of the average housewife is not always adequate to meet the situation. Rural people are naturally skeptical about medical care. They're so used to doing without it. The boy has said that we wanted to cut his foot off. Father himself is not completely sure of our intentions. He must be told that an operation could lengthen the heel cord, that the foot could be straightened, that he'll have to wear braces for only a little while. Yes, he has heard about these new surgical methods. He's also heard about their cost. How can such people as himself afford it? But if we can arrange it. Sure, he wants his boy to be like other boys. So does Ralph. Sure. That's what Ralph wants. And needs, more than anything. Children belong to tomorrow. We can give them nothing more promising than help. We owe them nothing less. They depend on us. They must depend on us. As we must depend on them in the future. For public health and public good, we're coming to think of man as a social being as well as a biological entity. To think less of a boy's money value economically, more of his value to himself, of his capacity to enjoy living and his right to. We cannot take care of disease without taking care of the person who has the disease. We cannot treat bodily ills and lose sight of the social ills so often responsible.